This is an excellent program to learn cardiac anesthesia. I think there's a really good balance between clinical skills and education, research, and academic projects.
I think first and foremost, it's the people here. But I think what really distinguishes is Feroz Mahmood, how he's a genius echocardiographer. What's unique about BI is that he interacts with all the fellows and trainees on a personal level on a day-to-day basis and really works with us.
When I was a fellow here, we had only 2 fellows, and now this has grown into full-fledged fellowship program with 4 adult cardiothoracic anesthesia fellows and 1 structural heart disease fellow.
We offer a comprehensive year-long fellowship program for fellows wishing to pursue a career in cardiac anesthesiology.
We do not train our cardiac anesthesia fellows for today or for tomorrow. We train them for the next 10 years. So this is a very advanced program, very comprehensive program that ranges from bread and butter cardiac surgeries to very complex valve operations, structural heart disease, mechanical circulatory support and heart failure. So it's a comprehensive, intense 1-year training which sets you up for bigger and better things in life down the line. Everything that we are doing at our medical center is state-of-the-art. We are one of the busiest mitral valve surgery centers on the Northeast, and as a matter of fact, one of the busiest structural heart disease centers in the country.
We recently started a cardiac transplant program, and I think one of the biggest unique selling points of BI is our structural heart program. Structural heart disease is a rapidly evolving field of cardiac anesthesia, and I think BI is at the forefront of providing access to fellows in that arena.
We are projecting that we'll possibly do 10 or 15 transplants in 1 year. And as a matter of fact, we have done about 44 cardiac transplants. We have far exceeded any expectations with excellent results which are comparable to any established cardiac transplant center in the world. This time is more. I'm proud to state that Beth Israel Deaconess Medical Center is the first program in the country to offer an imaging structural heart disease fellowship for cardiac anesthesiologists.
It's very high-level echo training. They have a really strong structural heart program here, which requires echo guidance of the procedure from the anesthesiology team, which is pretty unique to this program compared to a lot of programs across the country. So I think it's a really good place because you'll get enough exposure to open cases, exposure to percutaneous structural cases. There are a ton of expert echocardiographers here to learn from, and the learning is just endless.
We do echoes every day. We get the best mentors in the whole country, probably famous in the world, like Feroz, Aiden, Sankar, Ruma. They are our best mentors.
You really get excellent top-notch experience in building your echo skills, and that's something I think that you really can't find anywhere else in the country.
When you're thinking about cardiac, you think about 2 big things. One is the ultrasound training and the complexity of the cases. And I think Beth Israel has both. I think has one of the strongest, if not the strongest, ultrasound training in the country.
The clinical time is balanced. We're not spending extremely long days in the OR repetitively pumping through cases. We get a lot of balanced time to work on projects, do reading, study for boards.
Whereas our fellowship is primarily clinical, we do expect our fellows to perform and complete a scholarly project, which can range from quality improvement to outright prospective research as well as clinical research on the projects they're doing every day. Because we want them to have the experience of actually thinking of a project, designing it, executing it, and then finally being able to draw some inferences and results and presenting that at a national meeting and possibly as a research manuscript. Because we want to have them that experience where this is no binding for them to go into an academic position. But I think and I strongly feel, being a clinical researcher myself, that experience and that taste has to be provided in the fellows to demonstrate to them what it takes to think of a question and what it takes to design a project to answer that specific question. The most well-suited candidate for cardiac anesthesia fellowships are the ones who really want to push themselves into taking care of some very sick patients, some very challenging patients, and want to bring the best out of themselves every day. These are people who want to take care of patients, save lives on a daily basis, and also be very good technically in doing some advanced invasive procedures, doing echocardiography, and being part of the patient care team and not just mere service providers.
We deal with the perfusionists, we deal with the cardiac surgeons, the anesthesiologists, so you need to be a team player.
You know, the best thing about cardiac anesthesia is that we have a one-on-one experience with our residents and fellows.
For all our fellows in training, we offer, very guided mentorship that is, very structured throughout the year to make sure that they get comfortable dealing with these critically ill patients.
The clinical experience exposure has been superior. Couldn't have asked for anything better. Great cases. Faculty were always kind of invested in our training from day one and very supportive, both in the teaching environment and outside of work.
That family atmosphere, which is prevalent in our entire medical center, can be seen at par excellence within our cardiac division, because we are continuously spending time in challenging circumstances when camaraderie and teamwork are required at the very maximum. And that does bring the best out of everyone, and we try to bring the best out of everyone.
I was a resident here 3 years ago, and I was attending after that, and I came back to be a fellow after 3 years of attending. And I never regretted I made this choice.
The culture's great. I mean, the people, they treat us well. They are highly invested in our education, and it's a great place to train.